Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Assalatu wassalamu ala Rasulillah. Assalamu alaikum wa rahmatullahi wa barakatuh. So let's start our class. Today the topic is, I think some of you have attended this topic in Urdu, or most of you, but let's discuss it in English now. The topic is Fiqh of Botox and dermal fillers. We have to do this, we have to cover this topic because this is the need of time. Because everywhere we come across women, being women, obviously we want to look beautiful and pretty. So whenever we look around other women, either be housewives, working ladies, or on the TV media and social media, we see that there are women who are looking younger than their age. They might be in their 40s or 50s, but what they look like is they look very young. Just a second. There is some notification from the laptop. Yes. So we should know that everybody wants to look beautiful. But the problem is that since we are Muslims, and we have to know and see what are the limits that have been prescribed by Allah subhanahu wa ta'ala regarding haram and halal. So we all want to look beautiful, but the problem is that beauty now is crossing the limits. Every kind of haram stuff is being put in the beauty, the cosmetics, the skincare products, and even the invasive products used in different kind of injections and other things. We see that there is a lot of haram ingredient being used in this beauty industry, and also the agenda of beauty has now gone into another domain. It has turned into changing creation. So Botox filler is one of that domain that needs to be properly discussed and dissected, and we have to study it stepwise in order to evaluate if it's haram or halal, because it's a simple rule in Islam that everything is halal unless it is proven otherwise. So regarding this topic, Botox and fillers, we will follow a different strategy of studying today. Instead of applying the rules of Sharia right away, we will first go through the science and the scientific perspective of Botox fillers. And then in the end, we will see if the scientific perspectives, we will see that what criteria are being, followed by the science that fits into the criteria of Sharia, or what criteria violates the one that we have in Sharia. So let's start the class. Today we have the ayah from Quran, from Surah Nisa, ayah number 119, where Allah subhanahu wa ta'ala says in the Quran, he's basically mentioning the conversation that he had with the Satan at the time when Prophet Adam alayhi salam was being made. And at that time when the Satan had a conversation with Allah subhanahu wa ta'ala, he said, "And I will mislead them, and I will arouse in them sinful desires, and I will command them so they will slit the ears of cattle. And I will command them so they will change the creation of Allah subhanahu wa ta'ala. And whoever takes Satan as an ally instead of Allah has certainly sustained a clear loss." Now this ayah, we have been discussing about it ever since we started this fiqh of beauty, and we come across this ayah in our rules of Sharia, the principles of Sharia, where we say that changing creation of Allah subhanahu wa ta'ala is prohibited in Islam. So this ayah is basically the background of that rule that we study every time we do the class. So what happened was that when Allah subhanahu wa ta'ala created Adam, and since we know the whole story, Satan was actually jealous of him, and he had an arrogant attitude. He felt that that Satan was made of fire and Adam alayhi salam was made of clay. So he felt that he was superior, and since he was older to him, and he was praising Allah subhanahu wa ta'ala, and he was doing the acts of ibadah before Hazrat Adam alayhi salam, so he felt that he had the right to be respected more as compared to Adam alayhi salam. But when the whole scenario of the prostration occurred, and then he regretted and he declined the order of Allah subhanahu wa ta'ala, then we know that Allah subhanahu wa ta'ala expelled him from the Jannah. So this is the conversation that after being expelled, he actually kind of threatened Nauzubillah to Allah subhanahu wa ta'ala, and he from this ayah we can clearly say that see that his intentions are not good or friendly at all. He's jealous and he is feeling arrogant towards Adam alayhi salam, and that's why he has promised Allah subhanahu wa ta'ala that he will make the son and daughters of Adam, like Bani Noy, Adam, the descendants of Adam, he will make them indulge into the sinful desires, the nonsense and the desires which are actually prohibited by Allah subhanahu wa ta'ala, and he will make them slit the ears of cattle. Now, the slit the ears of cattle was a tradition in the old time in the Bani Jalia, when a male or female cattle like camel or sheep or the cows and goats, after breeding for some time, for some years, they mark them by slitting their ears, and they would say that this cattle, this camel or whatever the animal was, belongs to the XYZ, the lords that they had, Lat, Uzza, Manat, and these kind of the goddesses and goddess they had, the pagans we're talking about. So they used to say that we have dedicated this animal to the certain lord, and this animal can now not be used for any human purpose or human, for traveling or for eating or for drawing milk. So they said that this animal is now completely dedicated towards that lord, and it is not allowed to use this animal. So this again, he has promised for arousing sinful desires. He has promised that he will make people dedicate the halal things towards the fake goddess and goddesses, or he will make people claim the halal thing to be haram. The ones which have been made halal by Allah subhanahu wa ta'ala, he will make them think that they are haram. And he said that I will command them, so they will change the creation of Allah. Now, changing creation of Allah subhanahu wa ta'ala means that the person, he is not satisfied with the way Allah has created, and there is no abnormality or there is no fault, but still he feels uncomfortable with the way Allah has created him, and he wants to change that creation. So we will see how that happens. Let's look at the rules of Sharia. Quickly, the old students know this. For the new ones, we will just go through it very quickly. The first rule says there should be no element of deception. Like we say that whenever you do a fashion, follow a fashion trend or follow a certain cosmetic procedure, you have to be careful that there should be no deception. You should not look like someone you are not. Even at point, I feel like that the salons now have started putting on so much makeup that a person starts looking different as to what they are. So this is really important. If somebody comes in for a proposal, and then the girl is all made up like a pastry from a salon, and she looks very pretty, and once the marriage proposal is decided, and then the guy and the girl gets married, and then later on when the guy sees her, so there is a huge difference in the girls these days when they get their makeup done by salon. So the salon makeup artist, I would must suggest that they should not change the complete look of the girl. At least she should look like what she is. Although makeup is not a form of deception because you can always remove it, but these days it's again it's crossing the limit. We see on Instagram and all these channels where they completely transform a girl by putting on so much makeup that when she washes her face, she looks like a completely different person. So ideally, especially when it's time for a marriage proposal, these kind of makeup, heavy base and completely changed look makeup should also be avoided, because this would be kind of deception. In normal days, that's okay. So there should be no element of deception. Number second is there should be no changing in the creation of Allah subhanahu wa ta'ala, like we discussed the previous ayah. So there should be no changing. One should not change, since we know that this body is an amana from Allah subhanahu wa ta'ala, and we are supposed to return it. When we die, this body will be buried and it will mix in clay and be returned to Allah subhanahu wa ta'ala. So we are not supposed to do any hanky-panky with it, and we have to take care of it and do not change anything. Number three is it should not invalidate wuzu or ghusl. So any procedure that forms a barrier between the skin and water and prevents the touching of water to the skin, so that's definitely impermissible. Number four is there should be no harm or harm bigger than the benefit. We know that every procedure that we get at salon or at clinic, we know that it could have side effects. So one has to actually weigh that if the side effects are bigger than the benefit, then that procedure, in case of aesthetics and beauty, is not permissible. But in case of medical condition, we know that we have to weigh pros and cons, since every medical procedure, in case of operation or something, surgeries, we know that it can bring harm. But we have to again weigh that the harm is not bigger than the expected benefit. So there should be no harm or harm bigger than the benefit. Number 5 is that it should not make one appear as of opposite gender. This is a very important point because these days new fashion trends are coming up in girls, among girls and boys, which are making them look like of opposite gender. And even in clothing, we can see that there is a new trend coming up where unisex clothing, unisex perfumes are being introduced into the market. I'm really not very comfortable with this concept because at the end of the day, a man should dress up like, since we know that there is a hadith about it, that a woman is not supposed to dress up like man and a man is not, because they're cursed by Allah subhanahu wa ta'ala. So any fashion trend that makes you look like that of an opposite gender is completely impermissible. It should not expose aura because aura is satar and it is not supposed to be shown or exposed to anyone else, even of the same gender, for the purpose of beautification. You can do that for the purpose of medical emergency such as delivery or operation or any other problem, but not for the purpose of beautification. Number 7 is it should not be a presentation or custom of disbelievers or deviant groups. So any fashion trend, like we discussed that in case of Hindu women, they put on a bindi between their eyebrows. It's a sticker and it's kind of an adornment. So Muslim women are not supposed to put that bindi between their eyebrows because it's a tradition of Hindu culture. Number 8 is the materials used should be halal. So whatever you are using, whatever you are putting in over your skin or into your skin, it has to be halal. Because at the end of the day, we being Muslims, we are very concerned about the pure and impure, the halal and the haram, and then the najis and the pak thing. So we have to be very careful with the materials that are being used. Number 9 is the ruling does not apply to condition in case of fixing an abnormality. So whatever we have studied, these past 8 rulings, they become null and void if in case we are dealing with a patient or with a person who has an abnormality, a fault that needs to be fixed. So Islam is a religion of fitra. It's a religion of natural disposition. So it never burdens a soul or person beyond his capacity. So if there is an abnormality or a fault that is making that person stand out and is that is nothing normal. So in that case, these 8 rules becomes null and void, and that abnormality or the fault needs to be fixed, whatever it takes. So these are the principles of Sharia. Now we will move on to the main topic, and we will see, first we will see the scientific perspective of Botox and fillers. We'll weigh the pros and cons and what is it and how is it. We'll study them individually. First, we'll go through Botox and then fillers. And then in the last, we will review this slide again, and we will see which ruling fits where. And we will derive a complete, our own fatwa, in a sense that now, since we know this principle of Sharia, we will weigh which point falls where, and we will know that if Botox and filler are haram or halal. So this way you can actually search Google for side effects, the ingredients of a certain procedure, and how long does it last, and the details, and you can actually understand the concept that whatever procedure, new procedure gets launched in the market, you can actually, with the help of these 9 principles of Sharia, chalk it out if it's halal or haram. So you don't have to actually discuss it with anyone unless you're very confused and the procedure is very confusing. You can simply follow these 9 rules and search Google about each rule about that procedure, and you will get to know if it's haram or halal. So for those students who attended the daily skincare regime class, they remember the structure of skin. But for new students, I want to tell you a bit about the structure of skin, because if you don't understand the structure, you will not know the difference between Botox and fillers. So if we just quickly look at the structure of skin, this is basically skin, and it has 3 layers. One is epidermis, the other is dermis, and the third is hypodermis, which is also called as subcutaneous tissue. And below the hypodermis, we have this pink layer, which is called the muscle. So basically, normally, there are other structures in between, but since we are studying a simplified version, so basically there's skin, and below skin, you can see this is yellow, this is fat or adipose tissue, and below that is the muscle. Now, epidermis is this portion. So this is the first layer of the skin, outermost, and it is basically responsible for more than 80% of your skincare problems. This is dermis. So dermis comprises of the arteries, veins, the blood supply. It has the base of the hair. It has the oil-producing sebaceous glands, and then it has your sweat glands. So similarly, when we reach hypodermis has the main supplying artery, veins, and nerves, and some adipose tissue, the fat-containing tissue. So this is basically the structure of skin. So when we study Botox and fillers, Botox basically, where do we apply Botox? We inject Botox here in the muscle. So when you have to inject Botox, you will put in the needle from here and all the way through this. It will finally reach into this muscle and inject Botox here. But when we inject filler is superficial. So this is the place. The dermis is the place where we have to put in the filler. So when you have to inject a filler, you will inject in all through this way here and up till here. So dermis is the place where a filler is injected and Botox is injected into your muscle, and it goes into deeper layer, right? So let's see what is Botox now. This is the picture that I've attached. This is a brand which is actually registered by the name of Botox. But again, just like we have paracetamol, it's a chemical formula for a drug that is a pain reliever and also used for fever and other stuff. So paracetamol used to come in its original registered name as paracetamol. And then there were other brands like Panadol, Tylenol, and other brands. Similarly, Botox is a chemical formula. It's a toxin which is called Botox. But again, there is a brand that you can see in the picture. It has been registered by the name of Botox, but there are other brands such as Dysport and some other brand that has been approved by FDA. So Botox is basically a neurotoxin. What is a neurotoxin? Neuro means nerves and toxin means venom, right? So neurotoxin is kind of basically a poison, a venom that affects your nerves. So Botox is a neurotoxin produced by the bacterium Clostridium botulinum. Now, the name sounds a bit difficult to pronounce, so you can just remember it's a bacterial neurotoxin, or if you want to learn the name, remember the name, you can just simply call it C. botulinum for a short form. So Clostridium botulinum is basically a bacteria, and Botox is basically its secretion, you can say, or the toxin that this bacteria forms. So it is the same toxin that causes life-threatening type of food poisoning called botulism. Now, botulism is a very life-threatening disease, and it is very common among people who consume a lot of canned products, because the Clostridium botulinum, this bacteria spores are found everywhere around us, in the dust, in the soil, in the vegetation, and everywhere. So if the canned product is somehow not sterilized enough while it's being packed, this botulinum spores fall into it, and then once it's packed, they start growing. And especially if you go out in market and you see a can which is bulging a bit from top or bottom, do not buy it, because that means that this bacteria has started growing inside that can, and it's producing toxin along with some gases that are producing that bulge in the can. So botulinum is a fatal disease because it affects your primarily your respiratory muscles and along with your body muscles, because it's a neurotoxin. It paralyzes the muscles, and it's in babies it's called a floppy baby syndrome. So this is a very dangerous type of disease. The Clostridium botulinum bacteria is basically belonging from the same family as the tetanus bacteria. So tetanus bacteria is called Clostridium tetani, and they're like, you can simply say that they belong to same family. They're like brother and sister. So Clostridium botulinum is one strain, and Clostridium tetani, causing the tetanus, is another strain. So what they do is, the scientists, when they produce this Botox injection, they take the toxin from Clostridium botulinum and they deactivate it so that it does not give rise to disease. They deactivate it to a point that whenever you inject Botox into a certain muscle, it will only work locally and it will not spread into blood and cause disease. So it will basically, what it will do when you inject into the muscle, the Botox injection, it will completely or partially, depending on the dose, how much you are putting in, it will completely or partially paralyze that muscle which is being injected, right? So Clostridium botulinum occurs naturally in environment. It's commonly found in soil, dust, like we discussed, water, and domestic and wild animals. And since it's available everywhere, it's all around us, just like tetanus. So that's why, remember, whenever in our childhood or even when we grow up, if some of us ever fell on the road, immediately we were being advised to get a tetanus shot. That's because that roads and animals passing through it, and they have dirt and they have soil, so they usually have tetanus and this botulinum spores over there. So whenever your skin gets abraded and you fall down, there is a chance that those spores can enter into your blood and cause the disease. So that's why we immediately rush to doctor and get ourselves tetanus shot. So the vials of the Botox, that when we receive it, this, if let's suppose I ordered Botox, this vial that I will receive, they bring to us it in frozen chain. It has to be before we make it, we have to place it in freezer, right? So when you look at this bottle, this one, there's a rim of white powder just at the base. So if somebody is a non-medical professional, he would think that the vendor has delivered an empty bottle. But when you open this, there is just a fine powder rim at the base, and then you just put it in the freezer. And when we have to make it, then we mix it up with the normal saline and we inject it into the patient. So this vial of Botox contains 3 main ingredients. The first ingredient is botulinum toxin type A. There are different types of botulinum toxin, A, B, C, and further. But for beautification and for humans, we use Botox type A. Then the second element is human albumin. Human albumin, just remember for the sake, since we will be processing the information in the end regarding if it's halal or haram. So we have to remember that human albumin is a product that will be derived from human blood in order to be put into the vial of the Botox. So human albumin is another component. And the third component is sodium chloride, which is salt. So these are the 3 things that are present in the powder form at the base of each bottle. And when we have to inject the patient with the Botox, we just simply mix in normal saline in a certain amount, and then we take it out in the insulin syringe and inject it into the patient's muscle, whichever we want to paralyze. So again, I've told you about this, that human albumin, we have to remember, because we'll be processing it in the end, that it is derived from human blood. And what they do is that they work by blocking the chemical signals. Since we know that it's a neurotoxin, so what it does is that it blocks the activity of the nerve in that area. So this basically functions that whenever we have to contract a muscle, we definitely, the brain orders for the contraction, and the order is brought to the muscle through the nerves. So if we paralyze that muscle, that actually means that we are blocking the delivery of the order from the nerve to the muscle. So since the muscle won't be able to accept the order, it will not contract and will stay relaxed or paralyzed. So as a result, the injected area is temporarily, partially, or completely paralyzed. This procedure normally takes 10 to 15 minutes, depending upon the area you are treating. If in case you are treating a neck portion area or some larger area, it might take more than that time, but normally it's a 10-15 minutes, maximum half an hour procedure. And one injection lasts from 3 to 6 months on average, depending upon the kind of patient you are treating, the strength of his muscles that you are injecting, the quantity you are injecting, and it actually depends upon multiple factors. So it usually lasts for 3, 4, or 6 months. Now, what are the uses? First, we will look at the medical uses, because we already know that it has cosmetic uses, but let's look at the medical uses of the Botox. The first use is hyperhidrosis. Hyperhidrosis is a condition where there is excessive sweating in the body, especially underarms. And when the patient comes with the complaint of hyperhidrosis, he or she actually complains that they are sweating so much that it actually spoils the color of their clothes, and it results in a lot of the body odor and such kind of problems. So hyperhidrosis is one condition where you can inject Botox in the underarms, and this will result in decreased sweating in the underarms. Similarly, there is another condition which is called a cervical dystonia, where the neck muscles contract involuntarily. It's a problem with the neck muscles, where the neck muscles contract involuntarily, causing the head to twist or turn to the uncomfortable position or towards the opposite side. In case of, if it's very square, the head actually turns to the one side. So in that case, obviously the patient is unable to look to the other side, or there is, since it's involuntary contraction and he's unable to help it. So this is very uncomfortable and painful at times. So what the doctor does is that he injects those contracted muscles with Botox, and since they are paralyzed and relaxed, so the patient can actually regain his normal neck position. Number 3 is chronic migraine. Chronic migraine is like growing very rapidly among women, especially. So in case of chronic migraine, the people who actually have migraine attacks for more than 15 days a month, they are best candidates for it. So in this situation, a neurologist, actually, this job is not done by a dermatologist. A neurologist injects the Botox injection into the nerve that's causing the pain of migraine. So in that case, the migraine is relieved for 4 to 6 months. The next is Botox injection can also reduce urinary incontinence. Now, urinary incontinence is a condition where the urinary bladder is hyperactive, and even between the time period that you feel like going and peeing, a slight quantity of urine gets leaked because the bladder is hyperactive and it loves to squeeze all the time. So what the doctor does is that usually it's handled by a urologist. What they do is that they inject the Botox into the wall of gallbladder, and this paralyzes the gallbladder or relaxes it. And so not the gallbladder, sorry, urinary bladder. My mistake. Urinary bladder, and at the end of the day, urinary incontinence is temporarily treated, I must say. So, the next thing is muscle contractures such as cerebral palsy, in which actually the limbs it's again a problem within the brain. And the muscles and the limbs especially are contracted towards the center of the body. So the patient is really uncomfortable and kind of crippled. So in that case, the Botox is injected into the muscles and causes the relieving and paralysis of the muscle. So the person feels relaxed and better, like a straighten off. Strabismus is a condition which is common. We see people around us who have a squint, we can say in easy language, in which the eyeball is actually twisted laterally, like to outward or inward, medially towards the nose. So in that case, there is a hyperactive muscle which is pulling eye towards the nose area or pulling to outward. And when the Botox is injected into that muscle, so the position of the eye can be brought into the center in alignment with the other eye. And last thing is, we know that cosmetic purpose to treat crow's feet, frown lines. Crow's feet are the lines that are present around the eye area, on the outer border of eye area. They look like crow's feet. If you happen to, observe the crow's feet, you will see that crow's feet looks like those lines that we have around the eye area, especially on the outer corner of the eye. Frown lines are basically on the forehead. When you frown a lot, you start developing frown lines. 11s are the lines that are present between the eyebrows, especially if you are an angry person and you like to, you stay angry all the time. So you develop those vertical 2 lines between the eyebrows, vertical ones. Similarly, Nefertiti neck lift is, Nefertiti used to be an Egyptian queen, and she was very famous for her beautiful neck. So Nefertiti neck lift is a neck lift where you inject muscles in the platysma muscle, inject Botox in the platysma muscle of the neck, and it causes a very smooth neck along with shaping the jawline, and it's again a kind of treatment for the neck area. Let's look at the side effect. You would see this picture that I've attached. This is a very famous blogger, and she updated her journey regarding as Botox gone wrong. So you can clearly see that she was perfectly fine, and somehow, I don't know who gave her advice that she needs Botox, or she felt like, okay, let's give it a try. And she was perfectly fine, and she got Botox done for her crow's feet. And you can see that this resulted in lid droop. This condition is called lid droop. The lid has drooped. So now you can see she was perfectly fine with her eyebrows all aligned and looking alike. But now it's like she's trying to open this eye, and now this eye is looking like extra open, and this is droopy, and it's like completely misaligned and not matching it. It has actually ruined her look for the next 6 months. So the side effects are basically injection side reactions, which could include infection. That is very common. Even any kind of injection, when you put an injection anywhere in the body, it could result in infection. It could result in bruising, pain, and swelling. This is a common injection side reaction that can occur with any injection apart from Botox and filler. It can also result in headaches, slurred speech, trouble walking, and loss of coordination. So again, since we are dealing with a very fatal neurotoxin which has been deactivated and made made good for the therapeutic benefits, but again, it's a neurotoxin. So if you inject more, or if you fail to inject in the right place, or it can actually fire back. So it can create problem with the loss of coordination. So, that is very important, because if you got something done for the purpose of beautification and you end up having trouble walking, or you cannot coordinate your motor movements, then I think it's not worth it. Further side effects include heart problems, including arrhythmias, palpitations, sinking feelings. Then a person can have eye and visual problems such as double vision. That's called diplopia, reduced blinking, dry eyes, and ultimately it can result into blindness. So I don't really think so that it's worth it. If you go for a procedure and you want to look just pretty, although your eyes are mashallah working very fine, and at the end of the day you end up becoming blind, I think this procedure is not worth it at all. An important thing is that one of my friend, she's a very famous makeup artist. She got her Botox done, and I've seen this problem with her. She developed double vision. So she was really, really into trouble after that Botox injection, and it was actually a problematic for her, because she was a makeup artist, and she literally told me that whenever she's applying an eyeliner or doing a fine makeup, the eyeshadows and that stuff, she could not actually see the margin of the eyelid, because she could see two eyelids. Everything that she tried to focus on, she could not see it one. She used to see two of those things. So imagine if you are looking at a person and you cannot actually see his proper margin, and they seem to be there is a blurred vision, and you can see two people like overlapping images. So it's really a trouble. And she stayed she stayed with this problem for almost more than 6 months. Almost around a year she went through this, and she had vitiligo, bad vitiligo. She was unable to work, she was unable to do the makeup thing. And then she just she said she repented for that. And I think this is really bad. Difficulty in swallowing or breathing, especially when you get your Botox done for jaw reshaping. If you have a broad jaw and you want to have a slimmer jaw, and you get this Botox injected into your chewing muscle, so it can fire back, and it can result in difficulty in swallowing and breathing. Lid droop we have seen in the picture. Then urinary tract infection, since when you get the urinary incontinence injection done in your urinary bladder, it can again result into side effect and cause the introduction of an infectious agent into the urinary bladder, which can result into the infection. Urinary incontinence. So sometimes when you do a procedure for helping some problem, it can actually exaggerate that problem. So in case of people getting Botox done for treatment of urinary incontinence, they might even actually exaggerate this situation. Respiratory infections could be possible. Then tinnitus is a condition where there is constant ringing of bell in the ear. So again, a very uncomfortable thing, although it's not something that is causing like a physical problem. But if just imagine if you constantly have a bell ringing in your ear, you would actually go mad. High fever and tremors. These are the side effects, and you can actually look for these side effects at the official sites of all those brands which have been approved by FDA of Botox. Now let's come to dermal fillers. Dermal fillers. Now remember, Botox was a neurotoxin, and it was injected into the muscle. Now fillers are something that we injected in the dermis. Remember, second layer of the skin. So dermal fillers are gel-like substances that are injected beneath the skin, like in second layer, to restore volume, smooth lines, soften creases, and enhance facial contour. Now, basically, when we see Botox, it's like when we mix it with normal saline, it's like normal water. It's liquid, and it's the consistency is like water. But when we look at the fillers, and if you happen to just push a bit out and see what stuff is coming out of the needle, it comes out like a jelly, like a transparent jelly. So basically, the fillers are a jelly-like substance, and when we inject it into the second layer of the skin, they actually push the skin. They serve like the cotton, when we put the cotton stuffing into our cushions. So they cause it to plump. The cushion is all inflated and plump. So similarly, when we put in the gel under the skin in the dermis, second layer of the skin actually the gel pushes it out, and the skin plumps up. So this is basically used, this jelly is basically used to increase the volume, or the fill the lines or enhance. Like if somebody wants pouty lips, or if somebody wants high cheek, the plump cheeks, apple cheeks. So what they do is that they get filler injected into that area, and that area starts looking plump. So fillers are basically made up of hyaluronic acid. We will see different types of fillers, collagens, which may come again. Another point, remember, one point we have to remember from Botox, that it had human albumin. Now, the second point, in the dermal filler, you have to remember that they could be made of hyaluronic acid or collagens, and these things could be coming from pigs, cows, cadavers, and may be generated in the laboratory. So we don't actually know what is the source they are coming from. Even most of the time, the companies who are making these fillers, they don't know where is the hyaluronic acid or collagen coming from, or whatever, the other types we will see. Even the companies, only the few very famous one knows where their stock is coming from. Otherwise, most of them, they don't know if it's coming from cow, pig, or it's made in lab. So the person's own, and it could be a person's own transplanted fat and biosynthetic polymers. So again, the source could be from anywhere. It could be from these animals, or it could be made in laboratory, or it could be your own transplanted fat. Obviously, in case of your own transplanted fat, you would know that obviously they'll take fat from certain portions, especially from thigh or abdomen, and then they will take it through liposuction, and they will put it inside your whichever area you're getting that implant done. It should not be confused with Botox, as it does not work on nerves or muscles, and merely is kind of a filling or lubricating agent, right? So let's see the types of dermal filler. Let's look at the types of dermal fillers. Now, the first type is hyaluronic acid, which is again it's a water attracting chemical, which is again found in lots of creams and serums we see these days, because one molecule of hyaluronic acid binds 1,000 molecules of water. So hyaluronic acid is a very famous ingredient, which is available in topical form as well as in injectable form. So hyaluronic acid fillers are the most common fillers that are used. The result lasts from 6 to 18 months, and the most famous brands that are used in dermal fillers are Juvederm and Restylane. You might have heard their name. So if you look at this picture, this is Juvederm, this one, and this is Restylane. Then there is another that's a bit longer name, calcium hydroxyl apatite, CAHA. These are thicker and last longer than the hyaluronic acid one, and they last from 12 to 18 months, such as Radiase. Now, this one is Radiase. So depending upon, it's the doctor who decides which one do you want, because again, when we move to the more durable ones, which last longer, then the consistency is thicker and the composition also varies. So some are actually just serving to fill the space like a gel, and then some are actually boosting the collagen, and they dissolve and just pump up the collagen formation. Then we have poly-L-lactic acid, also called as collagen stimulators. They last for more than 2 years, such as Sculptra Aesthetic. This is a brand. It's a very famous brand, Sculptra Aesthetic. Then we have PMMA, which remains under the skin indefinitely. There is no scientific data as to when it completely gets dissolved, such as Belafil. Belafil is a very famous, and it remains under your skin infinitely. Like we don't know that when it will actually completely dissolve. Then we have the last thing which is called as autologous fat injection, which is also called as facial fat grafting, in which your own fat from your belly or thighs is taken through liposuction, and that liposucted fat is injected onto face, or somewhere else. Like some people also get them injected on their hips or breast and these areas. But usually they require more than one session, because your body army, your macrophages, the white blood cells, recognize that this is the fat of your hips or your stomach, and it's sitting somewhere else, which is, according to them, a wrong place. So what they do is they eat it up. So at times you need more than one session to get a required result. And most of the time, what the doctors do is that they overdo it, overfill the area with your own fat, so that after the macrophages consume the fat, there will be something left behind. Now let's look at uses. Now the Botox had more medical uses than cosmetic ones, but the filler generally has almost 90% cosmetic related uses and few medical uses. So the first thing is that it in case of moderate to severe facial wrinkles, it helps to smoothen out your skin folds such as laugh lines, tear troughs, horizontal necklines, etc. It is also used for liquid face uplift, which is also called as non-surgical face uplift, along with the use of Botox. Um, it's also used for lip augmentation, which is called, angel lips and pouty lips. And when we make fun of it, we call it duck lips. Again, then the fillers are used for non-surgical nose job, in which there is a hump, or the tip of the hump on the top of the nose, or the tip of the nose is round, and somebody wants to make it pointy. So they, instead of going under the knife, instead of going for a surgical procedure, they rather get non-surgical nose job done by using fillers. Then we have scars caused by acne, burns, or wounds, in which, such as in case of chickenpox, patients come to the doctor because they have huge pits, huge scars of chickenpox. So the fillers can actually temporarily provide relief, and you just put this gel under the scars, and the scar will pop out. It will become even. So in case of acne, burns, or wounds, this can help to normalize the texture of the skin. In case of breast and hip or buttock augmentation, like you want to increase the size, or in some cases, in case of cellulite, patient get these implants, not implant, I can say, the fillers or the fat grafting done to increase the size and smoothen out the texture. Also implant into the bone, tendon, ligament, or muscle as supplementary treatment for osteoarthritis. Now, this is a medical treatment where, as a supportive, like as a supplementary or as a supportive treatment in case of a patient suffering from arthritis, these injections serve as a lubricating agent, and these are injected into the tendons, ligaments, and muscle to smoothen out the activity of that muscle or joint. Last is they improve volume in areas of facial wasting, such as can occur in HIV positive people taking certain medications. So in case of treatment of HIV patients, and even in case of chemotherapy and other, in case of treatment from interferon in hepatitis, sometimes the patient actually has muscle wasting, and the facial features completely become, very skinny. So in that case, some people who are a bit beauty conscious, or they want to look normal under that treatment, so they get this facial fillers done to give a proper contour, the normal contour of the face. Let's look at the side effects quickly of the fillers. Fillers are again as dangerous as Botox when it comes to side effects. The major side effect that we have always heard of, and we have even seen, are the unintended injection into blood vessel. It can cause necrosis or death of tissue. Now, what happens is that if, God forbid, somebody went for a filler injection, especially in the tear trough or in the area which is close to eyes, and that area, by error, the doctor injects that jelly into your major artery or vein, which is draining or supplying that area, especially the superficial major artery or vein. So what happens is that gel will block the supply of that area. It's just like if you have a water supply of a field, and you cut that water supply, the field will die. So similarly, if gel is introduced into the blood vessel, the blood supplying to that area, to the eye or to that muscle, the blood supply will be cut off, and that muscle or the tissue will die. So this is very important because it can result into vision abnormalities, including blindness, which is again very, very fatal type of side effect that anyone can come across, and also stroke. It can result into life-threatening allergic reactions, such as products made with animals, for example, cow, pig, or rooster comb. So since we know that most of the filler companies don't know where their filler is, where they are getting that source or ingredient from. So if that is animal derived, it can result into lethal or fatal allergic reactions. And then again, it could result into breathlessness. It can actually result into suffocation and completely, blockade of your breathing airways. Infection at the site of injection along with bruising, pain, and swelling. This is a very common side effect. Open and draining wounds can happen later on. Migration, again, an important side effect and very frequent one. Sometimes you do filler of a patient and you tell them not to massage, but at night time, they really want to follow their regime, and then they put on their serums and oils and start massaging that area, and the filler migrates or move from that area to somewhere else, and that is again a nuisance to be handled. So formation of permanent hard nodules could be possible. Then the safety of these products used repeatedly over a long period of time has not been evaluated. Now, this is again FDA talking about it. They say that the safety of these products to be used again and again has not been established. Similarly, the safety of these products is unknown in patients who are prone to excessive scarring, such as keloids or hypertrophic scar. Similarly, the safety of these products is unknown when used during pregnancy, while breastfeeding, and in patients under 22 years of age, and rarely these fillers can end up into death. So again, the point is this, that whenever you go for Botox or filler injection to a dermatologist or to anyone, even for migraine or what they do is they initially after your consultation, and when you plan to get that procedure done, they make you sign a consent form. That consent form clearly says that if something goes wrong, the doctor or his staff is not responsible for whatever happens. So they are actually they have nothing to do with if something goes wrong, although a doctor will try to treat you if something goes wrong, fix that problem, but again, you cannot sue him or her, or you cannot blame him. So the consent form is something that is completely a burden over you, that whatever you are trying to get done, you are completely responsible for that. So again, I don't think that with so many side effects, which are again common, these are not rare side effects, these are common side effects. We do see across around us that that many Hollywood and Bollywood and other political celebrities with pictures of Botox gone wrong or fillers gone wrong. So it's not that this is impossible, that nothing can go wrong. If somebody claims, even he's top of the line professor in a very renowned university, if or medical hospital, if they say that these two injections do not have side effect, or they'll be perfectly 100% sure about the fact that you will not get any side effect, they're lying. Because no doctor, no matter how much expert he is, they can never be so sure, 100% sure that these side effects will not show up. Okay, so those were the medical side effects. Let's look at quick abstract and neglected side effects. Now, these are the side effects that are building as a result of this rat race. Again, we repeatedly use this word rat race for the beauty industry, because these are the side effects that we are seeing at the social and psychological level. So the first side effect that I usually observe around me is that the craze of staying wrinkle-free can cause mental health issues like anxiety, depression, body dysmorphia, and eating disorder. We know that there are models who eat, and then after they're done with their food, they go into the washroom and they put finger in their mouth and vomit the food out, just for the fact that they want to stay perfect with their physical appearance and they want to maintain a certain figure size. So this, staying perfect, looking perfect, staying wrinkle-free pants and wrinkle-free clothes are okay. But wrinkle-free person is not okay, because wrinkles are part of embracing your age. It's a natural process that you can just camouflage, you can hide it, but your biological clock is ticking inside. So what's happening is that it's building in kind of mental disorders of looking perfect, and all the energy and all the focus is upon fixing these lines and fixing these nose error and making the lips perfect and everything perfect. Similarly, spending more time and budget in apparent beauty has made men and women ignore their religious, social, and family responsibilities. There are many women around us who are very much into these things, and they would spend hours and hours sitting at a doctor's clinic or a salon just to get their treatments done. And I wonder what their kids are doing back at home. The servants just looking after them, and this is like a complete waste of time. Doing these things to a certain level is okay, but indulging them into to a level that you actually get drowned in them, this is not okay. People falling in this trap are never actually satisfied. They suffer from loss of gratitude of themselves and keep on changing one thing after another. So this again is a kind of vicious cycle. Once you start fixing your one thing, then once that thing is fixed, step two is you start noticing a problem in something else. Then you fix that, and step three is that you keep on finding flaws within you, one after another. You fix one flaw, and then you have another flaw, and you just you are trapped into that cycle of finding flaws within yourself and spending money and spending energy and getting those treatments done, and sometimes you do come across side effects as well. So it's like a constant pain. The next point is camouflaging one's age is like making a fool and running away from the time with a false perception of being young. This is what we talked about, that you're not actually young, you're just looking young. You are actually just showing off to people that you are young. Deep inside you, your joints, your muscles, your overall body is going down. It's like we know that the time cannot be stopped. So everyone who is getting these procedures done, they're actually deceiving themselves and deceiving others of their younger look. Otherwise, deep inside, they know how old are they. Poor and non-affording class feels left behind and depressed with their daughters waiting for the proposal. Now, since all around us we see aunties and young, girls in their 30s and 40s, women who are completely wrinkle-free and they are looking so young and pretty. So, in general, men want a wife who is as pretty and as young, and even she's 50, she should look younger for her age. So it's building a general criteria which is making a person who is someone from a lower socio-economic background and someone who cannot afford this much expensive procedure. These women, especially, I must say, they feel depressed, they feel left behind because they can't afford it. They can't afford to look pretty, and if somebody doesn't look pretty, people generally make them realize that they're not worth it. The series of studies have consistently suggested that increased risk of suicide among women who have undergone cosmetic breast augmentation. Now, again, they try to fix one thing and then they end up into depression because after fixing one thing, they start thinking that they've started looking like a Hollywood celebrity. And then they start expecting the results and people admiration. And once they do not have those status of relationship or admiration, that gives them more depression and results into suicide and such kind of, taking antidepressants and tranquilizers and these things. Beauty industry keeps coming up with new products and procedures for the sake of their money and making women believe that they are only worth as good as the look, as good as they look, reducing self-worth. Now, the new trend that's coming up is that women are as good as they look and men are as good as they can afford. So this is a new criteria of materialism and defining how good a man or woman is. So if you try to find a proposal of a girl and you look for a guy, most of the people would look for a guy who has a car, who has a home, and who is earning a lot of money. They don't care if the guy is earning haram or halal. They would just care that he should be making a lot of money, because again, the new criteria is that a guy is as good as how much he earns. Similarly, if a mother is or the guy is looking for a girl, he would look for a girl with a perfect figure, with with breast and with a very less measurement of a waist and big hips and long hair and perfect eyebrows and perfect hands and then pouty lips. They are actually building a fake or artificial sense of beauty. So this is what's the new criteria, that women are as good as they look. Also, the gone wrong procedures end up in disasters where the patient falls into vicious trap of fixing the new mess. This we have seen even in the picture of that blogger, and also with a lot of actresses, we have seen that Botox or fillers gone wrong. They have to continuously get new procedures done or repeatedly get those procedures done to fix that problem. So that again is a nuisance. Let's come at the Islamic stance. Now, we have studied the principles of Sharia, we have studied the sources, we have studied the side effects and how Botox and fillers work. Let's look according to those principles of Sharia if Botox and fillers are haram or halal. So the first thing that we studied over there in the first slide was deception. Any procedure that makes you look like what you're not is impermissible. So the first point is deception. Both the injectable treatments create a false look of what's not there. That is deception of looking younger for age and camouflaging the natural aging process. So again, deception is not allowed, and these two procedures are actually deceiving. So Prophet peace be upon him said, whoever deceives is not one of us. This is from Muslim 102. Similarly, in Bukhari 6966 and Muslim 1736, the Prophet peace be upon him said, every betrayer will have a banner on the day of resurrection by which he will be known. So the first ruling that we came across was deception, and somehow that ruling fits in on the Botox and fillers, because people who are getting that done are getting it done for the purpose of deception. They do not want to accept their age. They do not want to accept their flabby cheeks as they grow old. They want to look young. Number two is changing creation. Now, this is very important because this is the major ruling that applies to Botox fillers, because it is not allowed to change Allah's creation, even for husband, as obedience to creation resulting in disobedience to creator is not permissible in Islam. So when you have good enough lips and you want to follow that fashion trend where everybody has pouty lips, and you go to doctor and get your fillers done for the lips to look like a duck, that's a funny presentation, but again, people look like that. So this is changing the creation. You're not satisfied with what Allah has created you as. You want to look, and you want to look just like others, like if that's a fashion trend. So if someday there is a new fashion trend where there are people with very fine lips, then people would probably get their lips cut off just to follow that fashion trend. So changing creation is something which is completely forbidden, because Satan has promised Allah subhanahu wa ta'ala that he will create false desires among human beings and he will make them change the creation of Allah subhanahu wa ta'ala. So the Botox and fillers for the purpose of beautification definitely comes under the changing of creation. Number three is there should be no harm or harm bigger than the benefit. So Allah subhanahu wa ta'ala says in Quran, in Surah Baqarah, ayah number 195, spend in the way of Allah and do not cast yourself into destruction with your own hands. Similarly, Prophet peace be upon him in a hadith from Ahmad 2865 and Ibn Majah 2341 says there should be neither harm nor reciprocating harm. So now, since we have studied the side effects of Botox and fillers, do you think that this criteria is of haram and halal is applied on Botox fillers? Of course, because if you go for Botox or filler for the purpose of beautification and God forbid you end up having blindness, it's not worth it. If this is a real, the harm is too much bigger than the benefit that can be achieved. So again, this ruling also ruling also gets applied to Botox and fillers. Number four is exposing aura. So in case of like you're getting something done on face, that does not obviously comes under this ruling, but in case of breast augmentation or buttocks implant or taking fat through liposuction from abdomen, thighs or hips, one will be exposing the aura. Because if you're taking the fat from thighs or hips or abdomen, you're exposing aura. This is not permissible for the purpose of beautification in Islam. The last point, number 5 point, is a weak point. It does not completely apply to Botox filler, but again, since we already have 3 strong points being a ruling applied on the Botox and filler. So number 5th point, although it's weak, but it again supports the upper 4 points. So Prophet peace be upon him said, Allah does not put cure in that which he has forbidden for you. It's from Bukhari. So the important thing is the material used should be halal. Since in Botox, we know that human albumin is present there. Now, human albumin is coming from the blood, which is again another completely full topic that I'll be teaching you, inshallah, if blood is najis or not najis, because there is a difference of opinion among scholars. Some say that human blood is not najis, and some say that human blood is najis along with the animal blood. So we will be discussing that. And in case of filler, we know that since most of the companies do not know where the filler is coming from. It's coming from cow, or it's coming from pig, or somewhere from else, or it's lab made. So this is a weak point, but again, it's supporting the other points that we actually don't know where is the product coming from. So if it's haram, then obviously it becomes impermissible to use it. So again, looking at the Islamic stance, we see that Botox and fillers for the purpose of beautification are completely impermissible because they deceive, they serve to change the creation of Allah subhanahu wa ta'ala. The harm, if it comes, is definitely so much bigger than the benefit. And in case of the autografting or the fat the fat that is taken from the body and implanted somewhere else, in that case there is exposing of aura. And a weak point, which is not a major point, but again the weak point, is that sometimes we actually don't know where is the product the source ingredient coming from. So these things say that definitely Botox and fillers for the purpose of beautification is not permissible in Islam. But let's look at the mercy of Allah subhanahu wa ta'ala. The principles of Sharia we studied, rule number 9 mentions that the ruling does not apply to conditions which aim to fix an abnormality or a disease, right? So this was the rule number 9. So in case of fixing an abnormality, we can use Botox and fillers, but there are certain conditions which have to be fulfilled. These are conditions, these are 4 conditions. The first is that the medicine or injection is reasonably known to be effective. So, for example, in case of somebody coming to a neurologist for treatment of migraine with Botox, or somebody who has osteoarthritis and they want to get hyaluronic acid filler injected into their joint or tendon or wherever. So these the doctor has to advise that this is the known treatment and it will definitely help the patient. So whatever medicine or injection that is used under the rule number 9, it has to be reasonably known to be effective. The second is that it is needed. Of course, if it's not needed, it becomes if it's luxury, rule number 9 will not be applied. So rule number 9 only gets applied if it's needed and fixing and serves to fix an abnormality. Number 3 is there is no halal alternative. So if something is desperately needed by a patient and for a medical reason and there is no halal alternative available, then rule number 9 applies. Number 4 is the medical need established by a specialist, preferably by a Muslim doctor who is at least outwardly upright and God-fearing. So these rulings, or rule number 9, should not be self-applied on a person and thinking that, okay, I have lines and I think it's an abnormality, so I fall under the rule 9 category, so I can get the Botox filler done. These things have to be guided by ideally a Muslim practitioner who has some know-how of Islamic Sharia rulings about things. And or even if you don't have somebody in person in your area, you can you can discuss it with somebody online or somebody, there are so many doctors who have a knowledge of Sharia regarding these in their own fields, and you can get connected to such kind of doctors and you can ask them if the condition you are seeking that treatment for, which is bit doubtful, you should either go for it or not. Does your condition fall under the medical thing or under the cosmetic or luxury thing? Last slide is from ayah from Surah Maida, ayah number 71, where Allah subhanahu wa ta'ala says, and they thought there would be no resulting punishment, so they became blind and deaf. Then Allah turned to them in forgiveness. Then again, many of them became blind and deaf. And Allah is seeing of what they do. So this ayah basically reminds us of Bani Israel, where they used to ignore small rulings of their Sharia, where Allah used to prohibit certain things. And they always used to think that we are we are Allah's favorite, we are Bani Israel, so He will not punish us for small or petty matters. So they would just ignore them. And when this happened, Allah says that they became blind and deaf. So this was not actually in real sense of blindness and deafness. This was metaphorically used. These words are used as metaphorical words, that they were unable to receive hidayah, or they were unable to see themselves in hereafter. They were just really attached to the life of this world. They thought that nothing will, nothing will call on for the wrath of Allah over them, and they were completely denied in a denial phase where they thought that they will not be punished for anything. So similar is the case with our Muslim Ummah at the moment. We ignore a lot of halal and haram issues. We think that it's okay, everybody's doing it, let's do it, and it's a fashion trend, and then Allah is the most merciful, and we are the ummati of Prophet, peace be upon him. So he, just like Bani Israel used to think that they are the favorites, so we as Muslim also think that we are the ummati of Prophet, peace be upon him, and then there will be no punishment to us, and ultimately we will end into the Jannah. So we are actually following the footsteps of Bani Israel in this scenario. So this is basically ayah that reminds that we should not be neglectful to the small things which are the limits that Allah has prescribed for us, and we should not think that He will just pardon us for everything. If we do something deliberately and we don't, we ignore the haram and halal in it, and then we don't even seek repentance, then there is no way that Allah will forgive, because things, the rules that Allah has prescribed are meant prescribed for a reason. It's not we can say the rule of the jungle. So this was our class for today. I hope you would, and you had understood the basic concept of Botox and fillers and how the Sharia ruling have been derived for it. If you have any question, please feel free to ask in chat or unmute your mic. Any questions? Any doubts? Anything confusing that you could not understand? Any story that you want to share? I hope you have not fallen asleep. Okay, I think we don't have any question. In case you have any question, you can simply text me in WhatsApp group, and we will discuss, inshallah. I hope you enjoyed the session. It was not a boring one, although it was very scientific kind of session, but I hope you enjoyed it. Any questions, most welcome. You can ask me anytime, text me just in the WhatsApp group, and we will discuss. Let's wind up our class. Jazakallah for coming and attending the class, and I hope whatever you have learned. Okay, somebody texted me. Let me check the text. Okay, great session. Jazakallah khair. Thank you so much. Alhamdulillah, no doubts. Alhamdulillah. Okay, so it was a bit, scientific class. Inshallah, next session we will be doing about the fiqh and science of menstruation. That's a very important topic because Ramadan is coming, and most of the time, all around the year, we're not much doubtful about our periods. But when it's Ramadan, obviously we have to fast. So that is a very tricky thing that most of us become doubtful of, if we are pure or not, should we fast or not. So inshallah, next session will be about science and fiqh of menstruation. We will be covering the scientific perspective initially in that, so that once you know the science behind it, inshallah, you will never be confused about it. And again, we will do it in Urdu, inshallah, next week, and then later on we will have an English session. So let's wind up our class. Subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Assalamu alaikum. Amin wa yaki. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
मैम
जी बताइए. जी बताइए.
मैम तो जो जी वो जो लोग जैसे कुछ वाइटनिंग क्रीम्स इस्तेमाल करते हैं, तो उनके इंग्रेडिएंट्स का भी तो हमें ज़्यादातर नहीं पता होता ना, डाउट होते, तो वो उन्हें भी नहीं करनी चाहिए?
अच्छा, आइडियली क्रीम्स जो हैं उसको, वैसे तो ये हम उर्दू वाले सेशन में, बट मैं आपको रिप्लाई कर देती हूँ. क्रीम्स वगैरह के अंदर देखिए, इंपॉर्टेंट चीज ये कि अगर हराम और हलाल इंग्रेडिएंट्स का आपको डाउट है, तो आप उसको फिर ये कर सकते हैं कि आप उसको चेक कर लें. जो भी कंपनी जिसकी आप क्रीम यूज कर रहे हैं, कोई ऐसी चीज आपको उसके अंदर नजर आती है जो कि जैसे पिग फैट है या इस किस्म की चीज है, ऑल्दो कि अब इतना ट्रिकी है कि उसके अंदर मुख्तलिफ ई कोड्स के नाम से वो चीजें लिखी जाती हैं, जो कि मेजोरिटी कंज्यूमर्स को पता ही नहीं होता ये ई कोड्स किस तरह है, स्पेशली ईडेबल्स और इनके अंदर जो आपकी क्रीम्स वगैरह होती हैं. सो कोड्स के अंदर अगर आपको डाउट है तो फिर आप कंपनी को मेल डाल के पूछ सकते हैं, वो आपको रिप्लाई कर देती हैं. बट जनरली इसके ऊपर जो इस्लामिक स्कॉलर्स का स्टैंड है वो ये है कि they say that everything is halal until proven otherwise. So they generally advise the people that not to indulge so much into everything that a life of a Muslim in today's world becomes miserable. So if you start, doubting about everything, about the toothpaste and about the cream and about the lotion, that would be very difficult for you to survive in this world. So again, if you are confirmed or if you get to hear about some brand that brand is carrying in makeup or in skincare and topical products, if that has some haram ingredient, then you should ideally write to that company, because these days they reply you back. You can just write to them on Instagram or Facebook page, or the email address given on their website. And if they confirm you that yes, this is not halal, then you should stop using it. But in general, it's very difficult to check everything, and even the soaps you are using, or the sunblocks you are using, or the lipstick you are using. But if you get to hear about it, then definitely check.
Okay, Jazakallah khairan.
Ameen, ameen. Okay. So let's wind up the class. Inshallah, I'll meet you next week. Till then, take care. Assalamu alaikum wa rahmatullahi wa barakatuh.
Teacher, Allah Hafiz.